Now we'll start our discussion on musculocutaneous nerve. The musculocutaneous nerve is actually the main nerve of the arm because it supplies all the muscles all the muscles of our anterior compartment of arm. So what are the anterior compartment muscles of the arm? If you remember, that is the coracobrachialis on the medial side, biceps brachii, brachialis, right? So only three muscles are present in your arm anterior compartment. So these are all supplied by the musculocutaneous nerve. So that's why it is a main nerve of the arm, and it continues below the elbow as a lateral cutaneous nerve of forearm. If you see here, lateral antebrachial cutaneous nerve, so like this. So the musculocutaneous nerve only continues as a lateral cutaneous nerve of the forearm, right? That thing is important to remember. And next, it's a branch of, so from where it's coming, this musculocutaneous nerve is coming from, if you see the brachial plexus, it's coming from the lateral cord of the brachial plexus, arising at the lower border of pectoralis minor in the axilla, right? If you remember, in the lower border of pectoralis minor of axilla, it is starting at its course, that is a musculocutaneous nerve. Later it continues as lateral cutaneous nerve of forearm. So what is the root value? It's very simple. It's a root value, it's a nerve of ventral rami of C5 to C7 segment, right, of the spinal cord. So that is its root value from C5 to C7. So now let us understand its origin, course and termination. So of course we know the origin, it's from the lateral cord of brachial plexus in the lower part of axilla especially. It accompanies the third part of axillary nerve. So what is the third part of axillary nerve? It's a subscapular nerve, right? So not in subscapular, we have other two branches of third part, right? So it accompanies them and it enters the front of arm where it pierces the coracobrachialis muscle. So while entering, this is the coracobrachialis muscle, right, here on the medial side. So remember, musculocutaneous nerve will pierce the coracobrachialis muscle and come to the anterior side, okay? So then it runs downwards and laterally between the biceps brachii and brachialis muscle. So it will run laterally between the biceps brachii and brachialis muscle, and it terminates by continuing as lateral cutaneous nerve of forearm above the bend of elbow. So okay, one thing you need to remember, the musculocutaneous nerve will pierce the coracobrachialis, and later one more thing, important one, you need to remember that the musculocutaneous nerve will go posterior to the biceps brachii. It will not go above the biceps brachii, it will go below the biceps brachii, but it will go above the brachialis. So it will go above the brachialis, below the biceps brachii, and piercing the coracobrachialis, and finally continuing as lateral cutaneous nerve of forearm, right? So what are its relations, right? In the lower part of axilla, it is accompanied by third part of axillary artery and has following relations. So what are its relations? Anteriorly, of course, you can imagine it is having pectoralis major. Posteriorly, it will have the subscapularis, right? Medially, it will have the axillary artery, as we are saying third part of axillary artery, and also the lateral root of median nerve. The lateral root of median nerve is also passing here. Of course, median nerve means it's coming from medial cord of brachial plexus, and median nerve, in the name itself you can understand, it's coming on the median side. So medially you will have axillary artery and also the lateral root of median nerve. Remember, the lateral root of median nerve is medial to the musculocutaneous nerve, and anteriorly you have pectoralis major, posteriorly you have the subscapularis, and laterally you will have the coracobrachialis. So you can see this is a musculocutaneous nerve. Lateral to it you have coracobrachialis because it is piercing the coracobrachialis, right? So as it is piercing, it is on the lateral side, right? So that thing you need to remember. And next thing is, musculocutaneous nerves leave the axilla and enter the front of the arm by piercing the coracobrachialis. Yeah, already we know. Next, coming to the arm, it runs downward laterally between the biceps brachii and brachialis to reach the lateral side of tendon of biceps. It ends by piercing fascia 2 cm above the bend of forearm. So above the bend of forearm, it will pierce the fascia. Okay. Now let us see its branches and distribution. In the name itself, you can find out the branches. Musculocutaneous. It has muscular branch, it has cutaneous branch, right? And also some articular and communicating branches. Muscular branch, of course, it's nothing but supplying coracobrachialis, all the anterior component muscles like coracobrachialis, biceps brachii, brachialis, right? So The muscular branch supplies the following muscles: front of the arm, coracobrachialis, biceps brachii, long and short heads, and also brachialis. And the cutaneous branch is through the lateral cutaneous nerve of forearm, supplies the skin of lateral side of the forearm from the elbow to the wrist, including the ball of thumb. So, including the ball of thumb, everything is supplied by lateral cutaneous nerve. What are its articular branches? This supply the following: the elbow joint through its branch to brachialis. So, it will supply the elbow joint, that is its articular branch, and also the humerus through separate branch which enters the bone along with its nutrient artery. So articular parts are nothing but, articular branches are nothing but where the articulation is going on, at that side the artery is going and supplying, that is at the elbow and also at the humerus. So what are the communicating branches? The musculocutaneous nerve through lateral cutaneous nerve of forearm communicate with neighboring nerve, namely superficial branch of radial nerve. So it will communicate with the superficial branch of radial nerve, okay, and the posterior cutaneous nerve of forearm. This is important. It communicates with radial nerve and the posterior cutaneous nerve of forearm, and also palmar cutaneous branch of median nerve. So this is a question like musculocutaneous nerve communicates with radial nerve, posterior cutaneous nerve of forearm, and also palmar cutaneous branch of median nerve. So by this we have completed the musculocutaneous nerve. Next we will discuss about the brachial artery. So this is very simple. It is piercing the coracobrachialis and it is coming back of biceps brachii. It is traveling front of brachialis. And remember, coracobrachialis is lateral to musculocutaneous, and medial to it you will have the axillary artery and the median artery, right? And it continues as a lateral cutaneous nerve of forearm, and it is in relation with the radial nerve, posterior cutaneous nerve of forearm, and also with the palmar cutaneous branch of median nerve. This is important. So next we'll start brachial artery.